Good morning, everyone. We're going to give it about another minute, make sure everybody gets in before we get started. But welcome. We're glad that you're here this morning. I believe that's everybody that was in the waiting room. So we'll go ahead and get started. So welcome to Partners Health Management's Community Cafe for May. My name is Jeannie Patterson, and I am one of the community training coordinators here at Partners. And just quickly, we all know that, sorry, I'm trying to multitask. I don't do very well. We know how trauma impacts all of us in different ways and has a big impact on especially the brains of our children and their brain development, as well as impacting all of us in our health and in lots of different ways. So we're focusing on trauma today, its impacts and things we can do to help lessen the impact of trauma for us. So we have two guest speakers. We have Valerie Jackson, who is with Voice of New Beginnings, and also Michelle Paget, who is with the Lincoln County EMS. And I'll start off by inviting you, Valerie, if you want to start us off, introduce yourself and tell us a little bit about what it is that you do.
Hi, first of all, thank you for having me on today. It's an honor to talk about something I love so much, which is being trauma informed. As you said, my name is Valerie Jackson. I'm the owner of the Voice of New Beginnings coaching and training, where I help mothers triumph over trauma, transitions, and grief. I do life coaching. In addition to that, I also offer speaking opportunities where I can come in, speak with your organization as either a keynote or motivational speaker. I do trainings and workshops educating on being trauma informed, how to transition through the hardships in life, and teamwork operations. I also mentor middle school girls because that's that really trying age. And one of the schools reached out and asked if I would help them with some children that were kind of falling through the cracks. So I do that. I'm in the process of building up a curriculum now that can be used on a broader level. I'm a licensed pastor, and I lead women's Bible studies at a church in my community. And my husband and I are also business owners where we do party rentals and try to just bring joy to people's lives.
Now, like you're very busy. So thank you. Thank
Yeah,
you, Valerie, for carving out time for us today.
you're welcome.
So now, Michelle, would you introduce yourself?
Good morning. My name is Michelle Paget, and I am the training coordinator at Lincoln County Emergency Medical Services. I've been a paramedic for almost 20 years now. It's kind of a third career for me, but I tell people all the time that this is a job that I love. One of the other roles that I play at Lincoln County is over our peer support team. And I'll get into that a little bit later, but we developed a peer support team about 5, 6 years ago, where we educated a lot of folks on how to deal with the first responders when they're going through traumatic incidents. Um, Again, this is a topic like what Amai said, that's near and dear to my heart. Taking care of our own is super important, and being a big part of that is very satisfying. So thank
Great.
you for having me today.
Well, and thank you for participating, Michelle. Since you're unmuted, let me start with you with the first question, if you don't mind. And that is, what do people misunderstand about the trauma that first responders experience?
I think one of the big things that people misunderstand is that trauma is not just a one-time thing. Repeated incidents, the accumulation of having repeated incidents of trauma is something that can affect people for a long period of time. So not only, going to calls where, we experience where patients may die or be severely injured. It doesn't happen just one time. It can happen multiple times on a shift, but it definitely accumulates over the career of somebody who works as a first responder. I think the average time that somebody spends in working as an EMT or a paramedic is about 3 to 5 years. So that should tell you something about the stress that is involved with not only the job, but the stress that it plays in your brain as well. I don't know a whole lot about how it affects your brain, but I know that it does. I'm not a scientist. But the repeated exposure to traumatic incidents can change the way you change your worldview sometimes about how you think about things or how you approach different scenarios and stuff like that. So I think that's the biggest thing, is that it's not just a one-time thing, but it's the repeated exposure to all the different types of traumatic incidents that happen.
Great. Thank you. Thank you, Michelle. All right, Valerie, for you, on a community level, what does it look like for Cabarrus County specifically to become trauma informed?
Yes, I'm piggybacking off a little bit off of Michelle is like she was saying, trauma is not a one-time occurrence. It's something that can happen. And even though the event may have passed, the effect of the trauma still remains in our bodies. So being aware of that and also making room for people to take care of themselves. One of the topics that I really speak a lot on is self-care. I've created a format and a my mind just went blank. A program is called MX5 Self-Care. And that talks about 5 areas that you can focus on to just improve your self-care. So really promoting that opportunity for employees, families to have self-care. But in addition to that, when it's talking about being trauma informed as a community, you want to be mindful of who your audience is and make sure that as you're passing laws and as you're making changes, you're not adding to that trauma. You want to make sure that you are not creating systems and policies where barriers exist. So if you're going to create a policy, then make sure that that barrier is also being addressed. In addition, who's at the table, incorporating multiple voices. We don't exist in silos as individuals. So as communities, we should not exist in silos either, making sure that we have ample representation from the different sectors that comprise our communities, that comprise our governments. Who is at the table? Who is being consulted before anything is passed? We should be having people coming together, and not just based on my lifestyle and what I know, but really talking to the people that are in the community from the different walks of life so we can get a collective voice in the room to make sure that we are addressing everyone's needs. And then the last part I'll say is the proverbial is not what's wrong with you, but what has happened to you. Keeping that in mind to make sure while we don't make excuses, because there's still accountability, but taking that into account so that as we are rendering consequences, how are we doing that and what are we doing to support them in the process instead of just being punitive? We don't, if you just punish and there's no change, we've just wasted a whole lot of money. But what are some things that we can do to help bring about change as well, to strengthen so that when you come through, you've hopefully learned a lesson, you felt supported through the process, and then we can affect change as a community.
Thank you, Valerie. And Michelle, next question for you. You talked a little bit about already about the repeated exposure that the EMS personnel experience, and also about vicarious and secondary trauma and the burnout that you already addressed. So what are some ways that you would encourage first responders to take care of themselves to perhaps prevent some of those impacts?
So one of the big things that we talk about and we teach our folks is that whenever you have a traumatic incident happen and you feel like it's affecting you, certain things are going to happen to your body physically, cognitively, and those type of things. And we tell them these are normal reactions to abnormal events. So we try to educate our folks on that, letting them know that, the first 72 hours after an event, things that are happening are completely normal. Like you may have poor sleep habits. You may have bad dreams. You may experience increased stress. Also, you might feel more emotional than you normally do. Some folks put on this stoic face when they come to work, and you come to work, do the job, and go home. But if you experience a traumatic event, that may be totally different. Another thing that we do is we want to encourage our folks to check in on each other. So, your partner normally is joking and laughing and all of that kind of stuff. And one day they come in and, they're quiet and they're not being their normal boisterous self. That it's okay to, check in with them and, say, hey, what's going on? Is everything okay? And to normalize that has been a big push that we've tried to do with our folks, that it's okay to ask those questions and that kind of stuff. Another thing that we try to do is um, encourage our folks to tell their not tell their families about the incident that happened, but specifically, these are some things you may see me do because I've experienced something unusual at work today, because we don't want to traumatize our family members by telling them about the incident and that kind of stuff. We don't want to do that, but just letting your family know that, hey, I'm not sleeping well. It's because something happened at work. No, I can't talk about it, but just know, it's not you that I'm upset with. I'm upset with whatever the actual event was that was happening. So those are some of the things that we try to encourage our folks to have those conversations about. And then in terms of having them take care of themselves, um, it's kind of funny. We encourage our folks to get enough rest. Studies have shown that sleep is one of the best things to help with your mental health. But with shift work, that's one of the hardest things that we have to deal with. I mean, 911 calls don't stop at 5 o'clock. We're on shift 24/7, 365. Before I became the training coordinator, I was a shift supervisor on night shift. So my day didn't start till I woke up at 4 o'clock in the afternoon. And then I would work from 6 to 6. So, getting those calls at, 2 or 3 o'clock in the morning, there's not, your sleep cycle is interrupted from what we consider normal. Okay. I used to joke that, I'll sleep when I'm dead. But now that I've, learned so much more about how important sleep is, I tell people, do as I say, not as I do, because sometimes I still find it hard to get enough sleep. Um, but yeah, rest is one of the most important things we try to encourage our folks to do when they're not at work. And another thing is to find something not EMS related to do when you're not at work. So yes, it's good to have friends that, you work with and things like that, but have friends outside of that, whether it's with a church community or a pickleball club or, if you go bowling with friends or, different things like that, find something that's not EMS related to just totally turn your brain off from the work setting and stuff like that. So that's something that we try to encourage our folks to do. When you're off, be off, is what we want them to do.
Great. Thank you very much. I've always wondered about the rotating shifts and how hard it would be to be able to get sleep with your sleep cycle changing like that. So,
it's not easy.
So now, Valerie, how can everyday people, so parents, educators, faith leaders, employers, anybody in the community, how can we practice trauma-informed care in the community? And I would also add maybe also at home or just maybe in your neighborhood. And why should that be important?
I think that's a wonderful question. Thank you. To make it very basic, when you're talking about trauma-informed care, it really boils down to basic humanity. If you really think about it, it's how would you want someone to treat you and respond to you when you're facing a situation? One of the main things that helps so much is your communication. Being aware of who your audience is and using language for the person that you're speaking to. Like one example is I recently went to Honduras on a mission trip. I wanted to be heard. Many of the people that I encountered didn't speak English. I used apps. I speak Spanish, so I used my skills. But then also we had a native person who came with us and she translated. But it doesn't just go to speaking different languages, it's vernacular as well. When you're trying to help someone and support them in a journey, you want to make sure that you're communicating in a way that they can understand, that they can receive, that's going to help that individual. And then just being aware of what they're going through, kind of like what Michelle was saying. If you notice changes in behavior, that's so important. When just that little bit of showing someone that they matter, that they care, that you care, that goes a long way. It helps towards the healing process. And then I would also add to that, when you're talking about community care as far as the other organizations and how you can do that in everyday life, being aware of where people are at developmentally, considering their experiences. And one of the things I was sharing with Jeannie before we got on was, when I'm working with students in school, and even when I'm talking with people, I approach every situation as though everyone is going through something, because in reality, we all are going through something. So if we take that approach, and I'm not talking about tiptoeing through tulips, but I'm talking about, just being sensitive, being caring, being understanding when you're in a conversation, really listening, not in the sense of waiting for them to finish their sentence so you can jump in, but really listening and hearing what is not being said, paying attention to body language, taking the time to say, "Are you okay?" Pausing and giving people an opportunity to talk. When you pause and give people an opportunity to talk, even with children, you'll really get a lot if you, instead of asking and firing tons of questions, just present those open-ended questions and give them the opportunity to express themselves, and then respond with them with empathy. That goes such a long way.
Great. Thank you, Valerie.
Mm-hmm.
Okay, Michelle, you're up again. So what kinds of support are available, or do you wish were more available to you and to other first responders?
So, in terms of what we have available for first responders, right now in Lincoln County is, like I mentioned earlier, is we developed a peer support team, about 5, 6 years ago, through a grant that we got from SAMHSA. And one of the goals with that grant was to do education on mental health. So we took advantage of that money because, if anybody knows, training is expensive, especially if you have people that are subject matter experts in critical incident stress management and things like that. So we hired somebody to teach those classes, and I looked it up last night, and over a 1.5 year period that we had the grant money available, we had 300 hours of training on some type of either critical incident stress, mental health, suicide, how to deal with traumatic events, just the gamut. When I look back on it, I think we were feeding our folks with a fire hose, because that's all we were doing for about a 1.5 years is a ton of mental health training. But in some respects, I feel like it paid off, because we have had a group of about a dozen folks that really were dedicated to taking the training, to become part of that peer support team. So having folks that are interested in that and are willing to be a part of that team was super helpful. So we have that peer support team, and we offer that for any first responders in Lincoln County. So you don't have to work for EMS to contact us. We belong to the Fire Rescue Association here in Lincoln County. So, I go to those meetings every month and remind them that we're here if they need us. So the firefighters are able to reach out to us, law enforcement, the sheriff's department, the city police officers, the dispatchers, the telecommunicators. A lot of times they're the ones that are forgotten about, because they're the ones that, take that initial phone call. They don't get to, get follow up a lot of times. So one of the things we try to do is, whoever's on duty when when an incident happens, is to follow up with the dispatchers to let them know the outcome of the call. Because I feel like not being able to have the face to face with patients and things like that can be even more traumatic than actually seeing what happens. Because if you just hear something, your mind can make up all kinds of details that aren't even real, and that can be more traumatizing than actually seeing something. So we try to make sure we keep our dispatchers in the loop when when we offer debriefings and things like that. So that is another thing that we do is we offer critical incident stress debriefings. There's a timeline for that whenever we offer that. If there's a situation that happens on shift, we encourage our folks to ask their supervisors for what we call a timeout. So you experience a critical incident with a call, and you just need a timeout to kind of chill, get your mind back together and things like that. And the supervisors are super great about letting the folks have 10, 15 minutes just to not be on the hook to run the next call and that kind of thing. So they may come back to central base. The crews that are here will help restock their truck. They can grab a bottle of water, get a snack, walk around the building, whatever they need to do to try to gather their thoughts and that kind of thing, before they have to run another call. And we encourage our folks to ask for that, but we don't force it on them if they don't need it. And the same thing with debriefings. We don't force our folks. It's not mandatory to attend them. But one thing we do tell our folks is that if a debriefing is offered, that your presence there may be a benefit to somebody else. So we encourage our folks to go, and we pay them to be here as well if we're going to do that. So it's not just on their own time that they can come and do that. So those are some of the things that we offer in Lincoln County. Another thing we did with the grant, and I feel like I'm talking a little bit long, but you said I could talk as long as I wanted to. Part of the training that we did with the SAMHSA grant is we trained some counselors that are here locally, along with our providers when we were doing the peer support training and the critical incident stress management training. So we've got several counselors, licensed clinical social workers that have been trained along with us so that they know what we do. So it's not like if you had a therapist that you were going to and you started to tell them about an awful wreck that you had or something like that, they may get focused on the details of the wreck, not how that wreck made you feel or how it impacted you. So, and that's a lot of time what our providers have told us in the past is that, they go to speak to somebody and the therapist, all they want to know is more details about the gore and the things like that. And that's not what we're there for. We experience that all the time. We just need to be heard, like what Valerie was saying earlier is, showing up with empathy and not just sympathy. And I wrote a note down when she was talking about that. If anybody's ever seen the Brene Brown short video on empathy versus sympathy, that's super, super helpful for people to understand, just being able to sit there with somebody in the middle of whatever they're going through so that they can be heard, and not trying to come up with answers to fix things. And on the flip side of that, that's hard for us as first responders not to try to fix things because that's what we do. Somebody calls us on their worst day and we're there to help fix whatever the problem is. So when there's an incident where we just need to sit and be quiet, sometimes that can be very difficult. So having that additional training to help us understand the importance of that was super helpful for that. So we have the counselors, we have the peer support team. And then encouraging our folks to ask for help when they need it is something else that we want to make sure that our folks understand that they can do, and encourage them to do that.
Great. Thanks, Michelle. You have I know you had a lot of really good programs going on. I'm just curious, do the other agencies in Lincoln County take you up on your generous offer and come to the services that you offer for them?
Yes, they do. And thankfully, knock on wood, we haven't had a lot of requests here recently. A couple years ago, we did a ton of debriefings just because there was like a rash of really bad incidents that happened. And I'm not thankful that those things happened, but I'm thankful that they reached out to us, to provide those services. And a lot of times we'll reach out to other counties to bring folks in to help with those debriefings. So a lot of times if our folks are on those calls, it's not best practice for them to be part of that debriefing because they were impacted too, whatever that incident was. But yes, we've done them. We've received calls from fire departments, sheriff's department, city, as well as our telecommunicators. Every group that we offer the services to has reached out to us before.
That's great. That's great. Thank you so much. Okay, Valerie, what practical steps can Cabarrus County or any other community take to build a stronger trauma-informed community culture that promotes resilience and well-being?
Thank you. I think it's built primarily on three things: trust, teamwork, and transparency. When you are transparent, people tend to be drawn to you because people can tell the difference between, what's sincere and what's not. When you talk about teamwork, again, I'll say if we're really talking about moving towards being trauma informed, those collaborations, like Michelle was talking about, sharing the resources, it's great that they have that grant, but they're not just keeping it for themselves. Sharing that, partnering so that we can make better use of it, because you want it to filter out into other communities. I think, like Charlotte's our next door neighbor. If something happens in Charlotte, it's just a matter of time before it bleeds here, and vice versa. So if we're working together and collaborating, we can combat a lot of issues. And in that, being proactive, focusing on proactive measures and prevention instead of being more reactive. What are some of those things that we can do to get ahead of the game? And again, that's going to go back to getting those collective voices, including families, in the work that we're doing, even on a county and government level. Families make up communities. So having them come together, diversifying the funding and looking at other funding opportunities for the county so that we can go in. When you think about trauma informed, it's a whole body experience. When you're exposed to trauma, it doesn't just affect your behavior, it affects your mind, it affects your health. You have poor health outcomes. So bringing in the monies and the things, I know at one of the meetings I was at, there was talk of a community gym for adults, basically like an adult playground. Bringing things like that into the community so that not only are you able to then get the physical component, but you're able to build a sense of community by interacting with other people. Other practical steps are mental health first aid is a wonderful program that is available to any and everyone. Psychological safety, psychological first aid, that takes it to another step where you're able to learn how to respond to natural disasters. There's also the Trauma Coalition that our next meeting is June 3rd at noon in the Government Center. Those are just 3 examples right there of things that people can do and get involved in, where you're going to get the education that's needed. So if you're experiencing something, if you're facing something, you are equipped and have the skills to help in a time of need. But really just pushing that information out there and helping to form those connections and bridging those gaps, finding those things, increasing money into the youth. I'm going to say that because that's my passion, but also the reality is if you can catch them, research has shown, the data proves, if you spend more money into building up youth and intercepting, that saves money. That helps strengthen communities instead of waiting until they become adults and they're already incarcerated. Funnel that money into the education systems, funnel that money into strengthening families, because a child's first teacher is what? Their family. So pouring into those systems that are really going to help, then you have better people who are better equipped to contribute to society.
Great, thank you very much. I failed to say earlier that if anybody who is on has questions for Michelle or Valerie, you can either unmute yourself if you'd like to, or put them in the chat. And I also think I failed to introduce Amani Pagis, who is our With Partners health educator. Sorry about that, Amani. And so Amani will be, if you're putting it in the chat, Amani will read it for us. So I'll give you just a moment to do that. So I've got one more question for both our speakers. I was waiting to see if anybody in our audience has anything.
Whoops. I do. I'd like to
Yes,
just,
okay.
I want to thank you both for your time, because I think some of the things that you have said have been so valuable. I love what you said, Valerie, about it's not what is wrong with you, but what happened to you. Because I am a counselor and a coach, but I also have I have CPTSD myself. And so that actually was like, wow, that's very powerful. And I really love that. And the other thing that I heard was you don't want to relive the events by talking about it. I think that the speaker was talking about it's not important about what happened, but it's important to say, okay, um, I might be triggered by this. So right now, what I need from you is this, so that that person's needs can be met. But I love what you have provided for the professionals in your community to provide for the general population, but what if someone like me wanted to be a part of, because um, there sometimes talk therapy is not enough. Peer support is actually what they recommend. So where could someone find, and I've contacted psychology today, but you mentioned a few places, but then I think that I heard that that was for the professionals. Where could we where could we find, or where could we provide resources for peer support that maybe are free?
I'm not 100% sure what resources are out there to help professionals like yourself get that, I guess, trauma-informed information so that you can help people that have experienced traumatic events. I don't know, Jeannie, do you have any idea about resources for that, or Valerie?
Let Valerie go first. I'm looking something up.
There, I can't remember the organization right now, so I'll have to get back to you on that. But there is one that I know provides stuff for. I know Amazing Grace does some work. I'm not sure what her fee is. It's some is low cost, and then there's some on sliding scale. Also, certain insurance companies will provide programming for their policyholders.
Not not
I'm,
not what I
excuse me, I
have.
missed.
Somebody just put something in the group chat about,
It's me. I'm Chef
It might
Mark.
be partners. Okay.
okay,
Yes, yes. Can you say again what service you were looking for
peer
at little to
support,
no cost? Your
peer
support.
support for people that have experience, who have PTSD or CPTSD.
Okay, I deal with a peer support team in Mecklenburg County. Are you all located or? Oh, doesn't matter. We travel. I'm here to assist. So the shaking of the head will not work. Where are you located? Or the
Forsyth,
person Forsyth County?
yes.
Okay. I work with also an organization that's located in Versailles. It's Aspire Youth and Family Services. Now, I'm not sure if you're speaking of adults or youth. I work with both. In Versailles, it's youth. However, the director of the organization, her name is Kim Castana. I can link you with her, and then she'll be able to assist you with if it's some trauma, because we also work with trauma-based programs as well for adults.
That would be great if you could just put it in, link it in the group chat. I'm actually
Thank
going
you
to
so much. Yeah, thank you so much, Mark, for speaking up.
Yes.
So one thing I just wanted to mention, this is actually not referring necessarily to professionals, but if you're not, I don't know if you're aware or not, but North Carolina, through the Department of Health and Human Services, has a peer warm line. That's really for people who are in crisis. So it's something you can pass on to people maybe that you are serving. And I'll put the number in the chat for you. But it's a toll-free number. Anybody can call it 24/7 and speak to someone who's had some kind of lived experience. I said, really, I think it's less for professionals than it is maybe for the people that we serve. But it's the North Carolina Peer Warm Line, and I'll put that in the chat.
And Jeannie, I'm gonna read out a comment. This is from Takeem Marshall, the shelter manager of Fifth Street Ministries, and they are looking to provide training for their staff in trauma-informed care and TCI training. Does anyone know where they can get started?
Do you have any thoughts on that?
And I see Valerie, she responded, said she can help with the trauma-informed care part.
You want to tell more about that, Valerie? Valerie, still with us?
Val, you're on mute.
I'm so
Oh.
sorry. Yes, one of the roles that I played in a former life was I led a trauma coalition when I lived in Pennsylvania. And there we would travel to do trauma informed care trainings to different organizations. We went into schools, other communities to teach them. And then since I've been here, which has been now 7 years, I've done trauma informed trainings with a group of doulas and community organizations so that they get the idea of how to respond. And usually I will tailor it to the audience. So if, for example, I changed the language to make sure that it was specific to the doulas and whatever type of organization it is, I can tailor the training so that it's language they will understand. Because if you recall during the panel, one of the keys for being trauma informed and responding in a trauma informed way is to use language that is familiar with your audience. I think that's one of the reasons why Michelle is here. You don't talk to a first responder the same way you would do a lay person when you're dealing with trauma, because you don't want to further traumatize them. So that's something that I can do. There's different modules that I can go over with, if that's something you want. Thank you.
And I would kind of maybe like to add just quickly on to what Valerie's saying. One thing too is that in our trainings we talk about is that how easy it is sometimes to overlook something that we are doing that's part of our routine that might be trauma, reinforcing that trauma that someone's experienced. Even asking, maybe if you're doing intake and have to ask very personal questions, that could be very traumatizing for some people who've maybe not had much privacy. So I love that you can do that in the community, because we may not realize things that we do in our jobs to do our jobs that could be causing someone to have a trauma trigger.
And on the flip side, there are also things that you're probably doing that are trauma informed, but they just need a little tweak to become more effective.
Excuse me. I'm in this meeting here, and I'm on the phone with one of the directors for Aspire Youth and Family Services. The trauma that I was speaking of in Forsyth, she said, no, that peer support's not offered. But what is the name of this organization so that she can at least begin to speak to either the director or the spokesperson?
I'm not sure whose organization you're talking about.
The one that I'm in this meeting with, this training.
So our organization, Partners Health Management.
Partners Helping Management?
Yeah, Partners Health Management. We're one of the managed care organizations in North Carolina. Yeah.
Okay, so she's familiar with who you all's
Sure.
organization is. Kim, you can take it from there. I'm going to get back to the meeting.
All right, yeah.
I think Mark was trying to connect.
Yeah.
Andrea, was it you that was in Forsyth County?
Right.
Mm-hmm.
Sorry, let me unmute it. I am in Forsyth County. Mm-hmm.
And he was going to get you asked him to give you information about his organization. So
Yeah. Well, actually, I took a picture of some, let's see, where was it? Yeah. Amani
yes.
said, there's a catalog for free trainings. However, I'm not really interested in a training. I'm more interested in being, like a client, like someone like me, like the general population, not a professional, but someone actually looking for a peer support for PTSD. Do you see the difference?
Yes. Yes. And so one thing I would maybe say, and this may be very pie in the sky when I say this, that maybe if it doesn't exist, maybe we can create it.
I have looked, and I think creating it, I mean, it's great if we are being trained in all this,
right.
but if we're not providing, if we don't put it out there for our community, we're saying that there is so many people that experience trauma, but people like me who are professional don't even, but I'm both professional and someone who has experienced it. I don't even know where to go. And I looked into it, and there's nowhere out there.
And and Forsyth is so resource rich. If you think they would have it if it existed. So.
If they have a peer support for PTSD or CPTSD, that was my question.
So, Michelle, I'm going to pick on you again, since you have had experience with providing peer support. I understand it was SAMHSA funded when you did that. But do you have any suggestions about how to get a peer support type of thing started with people that are dealing with it secondhand a lot of times?
I think one thing that we have that everybody has to understand, the peer support that I'm talking about is support for our coworkers, whereas peer support in the mental health world, um, substance use world, that kind of thing, is somebody with lived experience. So our peer support just works with first responders. But she did bring up a good point: is how do you find um, groups of folks that have that lived experience, that are trained to talk to people that need those services? And that's a question I just wrote down, is like, how do you find those groups?
Are
Is
you
that
looking
something that Partners has a list of, kind of
are
thing?
you looking to service, like say a fireman that's going to assist like a peer support specialist, his coworker, because he's has lived experience of all of those things that you've stated. He'll be able to partner up with, say, a fireman in Mecklenburg County, hypothetically speaking, and walk him through lived experience on how to better help him cope with his trauma. Is that what you're asking?
But
Or
no,
for
that
a policeman, or or
it,
or, or
or
a trauma unit.
even for a
Continue.
therapist who's had a lot of
Even
experience,
for
a
a
lot of.
therapist. Correct. Now that I may be able to assist with, like how you would go about it.
I'm
Why
already
not?
seeing a therapist, a trauma-based therapist. I'm looking for peer support.
Yeah, I heard you.
But for
So
other
the best,
therapists, other people who are maybe providing human services and who are experiencing secondhand trauma. Does that make sense? Secondary
yes,
trauma.
it does. But for what she's looking for, she has a therapist, and somehow, some way in her spirit, it's not working for her. So what she's looking for is someone who has lived experience that can guide her through what she's going through now. Is what I think I'm understanding she's saying. Why not now? You all shoot a blast out to police stations, fire stations, hospital administrators, to start looking for people already still in the field that have experienced it, to begin to assist you all helping others. But you all have facilitators who can train the TCI care. So now these officers who've been through it, the trauma, who are now better on their own accord or through therapy, can now say, hey, I kind of understand what she's looking for. I've been through it. Let me see if I can help this here officer with trauma that I've experienced, how to better help him go through it. That's what a peer support specialist is. He's lived through the trauma. And
Well,
I have
Jeannie's doing, I think that I can't really see the screen that well. Let me look and make sure I'm speaking to the right person. No, um, the EMT speaker said that she provides that for for the colleagues, but unfortunately for a general population, they don't. So, that is something that could be a discuss, something to bring to the table, something to um think about and see what, I mean, I think the trainings are great, but if they're not provided to, if we can't get out, if we can't reach out to people like me for peer support, it's just something to bring to the table and have discussions about, because I can't find anything.
And
I
and
think if
There's a
you
need.
I think if you call 988, which is the National Suicide Hotline, they also can connect you with peer support.
I've tried Psychology Today,
Mm-hmm.
and they have a huge catalog and there's nothing.
Mm.
So just
and I'm not aware of anything that
something to
Partners
think
offers
about,
either.
something to put on the back burner. And if anybody ever, just this is being recorded, reach back out to me. Let me know if anybody can think of anything.
So would you be interested maybe in like brainstorming ways that we could provide that to each other? Be part of that conversation going forward,
Me?
Andrea? Yes, Andrea.
Sure. If I mean, it sounds like you all have the tools. The question is, how do we get it out to the public?
Yeah,
I mean,
I
that's grassroots. That's from the ground up. So
exactly. I
yeah,
agree.
something to something that's needed for sure. Thank you. I don't want to
Thank
interrupt anymore.
No, no,
No,
thank you.
no.
That's been great conversation.
I am going to mute myself now. So
You don't have to do that.
So
But thank you, Andrea. That was good
I put
conversation.
another resource in the chat. It is a email group. It's the North Carolina PLA Google group. And that group, they send out just various questions of people who are seeking support related to mental health services. So it is a lot of therapists in that group that are seeking services for clients. But I think if you join that group and you introduce yourself as a therapist yourself, that is looking for peer support, I feel like that is another great starting point to try to start that conversation.
Thank you for that, Amani. That's great. Also, Valerie, there's a note in the chat if you don't mind putting your email address in. If you don't mind putting your email in the address in the chat, somebody wanted to connect with you about possible training opportunities. And while Valerie is doing that, does anybody else have any questions, comments, ideas, insights about anything we talked about, or anything particularly for our speakers, but also for the group? Thank you, Michelle. Michelle and Valerie's contact information is in the chat now. Thank you, ladies, for that. Does anybody who are participants have anything they would want to ask before we ask a final closing question? If not, okay, ladies, this is the last question, and either one of you can decide who goes first. So the question to both of you is, if you could identify one takeaway from today's discussion, what would you encourage people to remember?
I think I would encourage people to remember that we all can do something. We all have a part that we can play. And no matter what we're all walking through, none of us are alone. But one, we have to exercise our voice so that we can be heard. And then the other thing is we have to listen so that we can hear others.
Great. Thank you, Valerie.
Mm-hmm.
How about you, Michelle?
I think something that I've heard today that I guess I didn't realize is I guess every niche has its own set of tools. And I'm thankful that as a first responder, we were granted that opportunity to do a lot of training to provide that service for our folks. But it sounds like there may be gaps to the general public and specifically to folks that, are already in therapy or already have things going on. It's like when we were talking about peer support specialists, I know our health department hired a peer support specialist to help with the opioid coalition grant that they have. We have a post overdose response team that is directed through the health department, and the peer support specialist that they hired is again somebody with lived experience. She used to be an addict and has been clean and has gone through whatever program that peer support specialist program has to go through. I'm not very knowledgeable about that, but there's training that they have to go through to help folks that have the substance use issues going on. So finding those peer support specialists in different specific groups, I feel like that's a challenge for the community. And I don't know if that's something that partners could take on. It sounds like some folks are willing to have those conversations, whether it's through
Partners can
counselors
partner
or
up.
other things.
Miss Michelle, partners can partner up with Life Connections. We offer peer support specialist training.
That's great.
If that's something that
Okay,
That's
I
great,
wasn't aware.
And Mark, by the way, Marcus put his email address in the chat if anybody would like to be able to reach out to Mark later. So thank you, Mark. Did you have anything else to say, Michelle?
I lost my train of thought. I'll think about it again and you can come back to me.
my apologies. My apologies.
It's okay.
Anybody else have anything to want to say about this month's topic about trauma?
One other thing that I would say that I find very helpful and that I see is still a concern, we use different language in the various organizations that we're all working with to mean the same thing. One thing that would help as far as the county becoming more trauma informed is to have universal language when it comes to being trauma informed and the services that we would provide, because we have clients that go to one organization and they're told something in one form of vernacular, then they go somewhere else and they're told something different. It's the same thing, but it's causing confusion because we're not using the same terminology. So if we could all come together to use same language so that we're not confusing people, that would help, while at the same time though understanding that when we're then doing one-on-one or when we're doing our groups, once we get them in the door, then we can break it down into that niche specific language.
Thank you for that.
Mhm.
Any last words? If not, Amani, I'm going to turn it over to you.
All right. Well, thank you to both our speakers, Michelle and Valerie, for this roundtable talk about trauma informed care. And thank you to all of our participants for joining us this morning. We hope that you join us next month on June 24th. Our topic will be a spotlight on our community collaboratives that are offered through Partners Health Management. So hopefully you got some information that was useful to you, and I hope you have a great rest of your day. Thank you.
Thank you so much for being here, all of you, especially to Michelle and to Valerie. Thank you so much for giving your time to share about your work.
Thank you for the
Thank you.
opportunity. Appreciate it.
Thank you.
Everybody have a great rest of your week.
Thank you.
Thank you.
Lonnie, if you'll stop the recording.